My name is Karina Polachek. I am a nurse practitioner in ENT and I work in Chillicothe. I initially had an undergrad in exercise physiology. I was always drawn to the science and human anatomy, but then I opted to go toward the more clinical side as well to get and put my feet into nursing. I started here as a tech when I was in nursing school. And then I graduated, I got my RN, and I worked on a couple units where I ultimately ended up in ICU. And when I was in ICU, I was afforded the opportunity by Adena to pursue my career and get my master's. I think patients should choose Adena because they get a community-based sense of care, whereas in the bigger cities, it's less personal. So you're gonna get a very interpersonal relationship with your provider here, and you don't have to travel far away from home. You can stay close, you can get to know your provider on a more personal level, and just really feel comfortable when you're getting treated. I work on a very team-based perspective, and when I say team, I mean me and the patient or the patient's parents, seeing as I work with a lot of kids. So by that, I want to make sure that we're in agreement on the treatment plan. I want to make sure that they understand the treatment plan and they're comfortable when they leave the office. If there's something they're not quite comfortable with, I want to find an alternative to that. So that way we're all on the same page and we're all looking for the best outcome for the patient. I can see the impact in a lot of my patients' lives, especially the little kiddos. We have patients that come in with speech delays, and it's really something as simple as, they have fluid behind their ears that's been there for a while, and they just need ear tubes to help prevent that fluid buildup. And they will be back on track to where they need to be speech-wise. And, it's like it was never an issue. And I think, in the community, that's really important because a lot of patients down here in the rural areas, they can't travel far, they can't go to Columbus. So when they can come here close to home and get treated for something as simple as fluid behind the ears, I think that's really important to the community. Outside of work, I have a wonderful husband and I have a daughter. I like to run, I like to read, I like to sit and watch movies with my daughter. I was born and raised in Chillicothe. I went to high school just a few miles from Adena campus, so I'm really rooted in Chillicothe, and I like to do all the fun things downtown. Oftentimes, nurse practitioners can be the first line provider for patients trying to get into a specialty, and being so closely collaborated with our physicians and surgeons really helps get those patients in quicker.